Welcome to JAT Chat presented by the Journal of Athletic Training, the official journal of the National Athletic Trainers Association. I'm Dr. Kara Radzak and your host for today. The purpose of today's event is to provide some more background and information on the recently published manuscript entitled Session Rating of Perceived Exertion Combined with Training Volume for Estimating Training Response. Today, I'm joined by two of the manuscript's authors, Dr. Chris Napier from the University of British Columbia, who also practices clinically as a physiotherapist at Restore Physiotherapy, and Dr. Max Paquette from the University of Memphis. Chris and Max, thank you for joining me today.
You're welcome.
Thanks for having us.
So first, let's get into how you guys ended up on this topic. Your group's research really addresses that continuing conversation about how to best evaluate the load that's placed on runners. And before we go into the discussion of the manuscript, let's get some terms out of the way. So how do you differentiate between the different types of load that go into a runner's total training load?
Go ahead, Chris.
Generally, when we're talking about training load, we can divide things up into external and internal training loads. So external training loads would be things like mileage, quantities of volume, so it could be time, that sort of thing. And then internal loads are really the body's response to those external training loads. And we can measure those things in things like heart rate or rating of perceived exertion, which is what we did in our paper. And you can combine those through a simple formula of multiplying the external load by the internal training load to come up with a total training load.
And just to add to that a little bit, what Chris mentioned about internal loads, it's the response to the external loads, but in this particular paper, we're talking about the physiological response, so not necessarily the mechanical internal loads. We're not talking about tissue stresses and strains, just the physiological response.
So really getting a sense of how that runner feels in addition to what the runner's doing.
Feels, yeah, and also it can also be quantified physiologically with heart rate and blood lactate and other measures like that. Although in this particular paper, we did, as you said, Kara, just quantify the perception of effort, which is a measure of feeling, if you will.
So what experiences or previous research led you to this path to looking at taking the external and internal and combining it?
I think Max and I probably come from a similar background here. Max and I are both washed up runners. We both actually ran at university in Canada. We've been sort of ingrained in the system of mileage as being sort of the way that you quantify your training for some time. I think for a long time that was just accepted by both of us. And then Max through his coaching and myself through my clinical work, I think started questioning some of that and certainly looking at the literature on training loads. You see this sort of example of external and internal training load, yet it's not really something that was done in running and still isn't done very often in running. Most of the people I see in the clinic can easily tell me exactly how many miles they ran last week and what their average mileage is, on a weekly basis over the last 6 months. What they plan to do over the next 6 months, that sort of thing. But when we start asking about things like, intensity and that sort of thing, it becomes much more murky. And so being able to quantify the total load on the body is really important because we're looking for changes in that. And that's not always readily identified by just the external load.
Clinically and in coaching, like Chris mentioned, that's perfect explanation of how we've come about. For me as well, it's been looking at the running injury research and how if you really take a look at what's out there in the conclusion, it's really all over the place, and it's really hard to understand. If you're not immersed in the literature, it's hard to read a paper that says if you run less than 50 miles a week, you might get injured. If you run more than 50, you get injured. If you run 32 miles, you get injured. So there's really basically like if you're running at all, you get injured, and there's no differentiation between amount of running. And so that for me as well led to, well, obviously that's not correct. There are no thresholds of mileage that will lead you to injury. It's more so there are other factors at play that we're missing. We're not capturing by only looking at distance. And so I think the combination of both of our applied and clinical knowledge has led to these questions, in addition to obviously some limitations in the literature at the moment.
So giving us the overview of what you guys actually did in this study.
Yeah, so this study actually came from, I was doing a larger study where we were tracking runners training over a period of about 7 months. And we had in that study a large number of people where they were using the RunScribe sensors, which is just an IMU that you put on both laces. And so that IMU can track a lot of training variables, so things like time, distance, that sort of thing, but also some biomechanical variables. So I also in that study was tracking RPE on a session RPE basis for every run. And so, Max and I were also working on a couple other projects at the same time that were all looking at the same sort of question. And so I said, Max, I've got this data, which I think we could actually sort of look at to help really sort of see, the differences between just using time in this case and adding in some other variables. So, so what we did was we took a subset of the sample that I had, and we needed people who had some sort of continuous data, and we could look at that. So we excluded anyone who didn't have 4 weeks of continuous data with all their RPEs entered and all their time. But otherwise, it was a group of runners who were following a self-selected training program. So they weren't following a coach-led program, for instance. They weren't all doing the same thing. And then what we did is we looked at a week-to-week change in their training based on the different variables. So we looked at what percentage change happened from week to week when we just looked at time. So duration of all their runs accumulated in that week. Then we looked at what that looked like with steps. And then we also looked at it for shock, which is a variable that was recorded by the RunScribe sensors. So basically cumulative shock, so that each impact of every step accumulated across a run and across the whole week. And then we also had RPE values. So we then multiplied each of those external loads by an RPE value. And then we looked at the data, and that's sort of how we came up with this.
What'd y'all find?
So we found that there was a large discrepancy between the variables, most notably when we added in that internal training load metric. So when we added in RPE, we noticed that there was a large underestimation of the week-to-week changes in training load. So, in runners that, perhaps were increasing their training load or thought they were increasing their training load by 5 or 10% from 1 week to the next when they're just looking at the total time run. We found that they are actually increasing it perhaps 20 or 30% when you actually looked at the intensity and their internal training load.
So then how does that fit into this? And it really challenges the long-held belief of only increase by 10%. So how do you utilize your findings in this way?
Yeah, and I think as Chris said, because this was part of a couple of other papers on the topic, I think the cool thing is that these findings are exactly in line with the other work that we've done. So it's not a fluke where like, oh, this is happening in this group. We showed this as well in high school runners. So, how we apply these findings is, as Chris said, I think the take-home message across all three of these papers is that there's really value in looking into training beyond just distance. That's sort of the overarching point, right? I want before we give a take-home or an applied use of it. The challenge with RPE is that it's a measure that you obtain after the fact, right? So you can't really, you can prescribe it, but it kind of defeats the purpose a little bit. So some coach will say, well, if RPE is the way to go, like, should I just say, okay, go run 30 minutes and an RPE of 3, right? And as Chris mentioned, then we can get a training load of 30 minutes times 3, which would be a training load of 90. The problem with that is by prescribing a RPE of 3, you're doing two things. You might sort of trick the athlete in rating the RPE at 3, whereas it might actually be higher or lower, right? Just because the person's heard 3, they might just write down 3. You might also start introducing some issues like, oh, I don't feel very good, but I'm supposed to be at a 3. And I don't want to write down 3 or I don't want to write down 7 because my coach might think I'm not good enough. Like, I'm working way hard, so I'm going to still put a 3 down, So it's hard to prescribe RPE. So it needs to be clear that the application is in monitoring, not necessarily in prescription of training.
Can I just add quickly to that, yeah. Max? And another issue with that is that it's meant as a total session RPE. And so, it's meant to reflect back after the fact on the entire session. And you may start off at a 3 and it feels like a 3, but that could quickly ramp up to a 5 or a 6 or a 7, as Max said, depending on your, how you're responding on the day. So it's another reason why it doesn't work so well with prescription. It's meant to be a sort of a global assessment of the entire session after the fact.
Yeah. So the main thing is to make sure that practitioners, whether it's clinicians or coaches that are working with athletic trainers, that they understand that this is really a monitoring tool where you're really trying to make sure that what it is that you're prescribing is actually the outcome that you're getting. And so it does require a bit of work, on the back end. You've got to make sure the athletes are recording things properly and they understand what they're asked to do. What is RPE? What does a 3 should feel like, or so on. Now, that also depends on the person. So you have to be clear that it's among yourself and not between people. You get that issue among team where, they're all recording their RPE, and then one runner is looking at what did you put down? I have 3. Okay, I'll put a 3 as well, right? So there's a lot of things you have to consider to make sure that this is repeatable and reliable. So, but yeah, the value is just like Chris said. It just gives us a broader picture of what's going on with an athlete in response to training, and as opposed to just assuming that if I give you a 5-mile run, like that 5-mile run is doing the same thing to you every single day, even though it's not, right? Mm-hmm. And it's the gap we're trying to fill, is really capturing what a certain run is actually doing to an athlete. That's the application of it.
Yeah, it's also, taking that 5-mile run example, it's saying that it's the same as doing 5 by 1 mile repeats, right?
Yeah.
Which would be very obviously not the same, right?
Right. So then you can take that information and inform your future either program development or build in rest days. And
yeah.
And how do you go ahead, Max?
Well, I was going to say on the adjusting the training, for me, I use Google Sheets as my monitoring platform, if you will, right? It's not a fancy app or anything, but the athletes that I coach, they know to log their data every day after their runs within an hour or so. And so I can, if I'm not at a practice, which I'm not, I only see the athletes I coach, twice a week, sometimes just once a week. So for me, it's really important to get these data, right? Mm-hmm. If I'm there every day and I see athletes all the time, you can pick up on who's tired and who's not responding well because of, mannerisms, how they're holding themselves, how they're doing in a workout, what they're saying, those kind of things. But when you're not around, it's so useful because now you can get something much more out of your monitoring approach than just the distance. And so I'll go and see, oh, wow, that run was meant to be an easy run, but the RPE was real high today. And this athlete didn't tell me this. They put it down, maybe they're hoping that I don't see it. They're honest, and that's the important thing. But then I can go and say, hey, you know what, tomorrow, let's just not do the workout. We'll do that the next day instead, right? You're not quite recovered yet. So you can be proactive for future sessions using the data in your monitoring approach to make adjustments.
Now, Chris, how do you utilize this in somebody who's coming back from an injury?
Yeah, so often when someone's coming back from an injury, we might be using like a return to run program, whether that's starting off as a run walk or just starting off with easier running and that sort of thing. And so, for me, it gives much more information. Obviously, we're going to be taking into account things like pain. But, when someone hasn't been running for a while and they're coming back into running, especially more experienced runners who have a bit of a training history, they may want to jump in and start running faster or longer when they're really not ready for that. And so, adding this into what they're reporting does two things. One is it tells me how they're accommodating to that sort of return to run. But it also tells them how they're accommodating. And I think that's even more valuable because they actually they're forced to reflect on how they're managing the load that they're starting to increase. And we can set some sort of arbitrary, week to week increases. I say arbitrary just because, the 10% rule that you mentioned hasn't really panned out with the research. We've seen in a number of studies it can be up to 30%, but of course those are all looking at just volume. So I think there's opportunity to look at actual training load using internal and external metrics to see if there is more of a magic number or more of a range that people can accommodate. But I think what we can do with the data in the clinic is we can look at that and see how they're responding to it. And then some people you may sort of go slower with and increase, closer to 10%. Other people may be able to ramp up faster towards 30%. But the data I'm getting is much richer as a result.
What recommendations do you have for somebody who might be in like a high school setting and they don't have access to something like a wearable technology that you guys utilized?
Well, I mean, the big finding from our study was actually you didn't need that. What we found was that time times RPE was probably just good enough for everyone. There might be we found that with the cumulative shock data, when there's a lot of variety in training, that may be a little bit more sensitive to those changes. But that's something we have to study further. But for the vast majority of people, it's just a simple formula of time times RPE.
Yeah, and that's the major finding of the other paper that we had that was led by Megan Ryan with the high school runners. And that high school team has since adopted this. They were using this already, but now they're using it more objectively with the Google Sheet and all that information, and so it's being tracked constantly. And there's about 47 kids on that team. So, and the coach meets with them regularly, of course, but it's also nice to get those additional data to confirm what he might think or feel.
Yeah, that's one of the beauties of this paper is that there's something that is very easily implemented across all levels of training and of expertise.
The other thing that we didn't really talk about in there that I think is valuable, especially those high school coaches who might be at high schools that have kids with families who may not be able to afford GPS watches and things like that. The beauty of time and RPE is that time is a cheap is a cheap metric to measure, and RPE is obviously a free one. So a $35 Timex watch from Target or Walmart, seems to be at least sufficient the way that we're based on the findings that we got.
That's how we really used to do it anyway.
It's true.
Just a stopwatch, right?
And that sort of thing, because you didn't have your heart rate displayed and cadence and all these other things. So you actually had to tune into how you're feeling and just monitor time.
So based upon the conversations that you've had, especially with the high school athletes that you've worked with, one of the things that I know when I was working at a high school as an athletic trainer is you see this wide variation of athletes that this might be their first time doing a sport or even running, but yet they're going out for a cross country team, and every high school athletics takes all comers, right? So how could you potentially utilize this in that wide range within one team of abilities?
Yeah, good question. I think I mean that's an important question because I would say the majority of high school teams don't deal with necessarily runners that are in it for performance necessarily, right? There's a lot of kids who just do it for the social aspect of it, um, and may still get injured or may still, eventually want to perform, but at least early on. And I think I'm not sure I would. I'm not sure I would necessarily focus on monitoring in some of the younger kids, especially like middle school, elementary school, and then young high school kids who are just kind of getting started and trying to figure out what running is about. I probably wouldn't spend too much time on the monitoring aspect. I would more focus on educating runners about, feel and perception, and instead of focusing on paces and distances, more focusing on how they feel, how they respond, doing the right things around running. I think there's much more bang for your buck there than actually trying to, micro measure everything at that level. Because honestly, they're probably not running enough at that age that it would cause many issues. I mean, it's possible, but I'm saying generally it's not a big issue. And so again, it's just more about education around these things, so that by the time they get to an age where they might be training more or more serious about things, and there could be a higher risk of injury, then they know what to do and how to do it, and then you can focus on those things a bit more then.
Yeah, I agree. I think it sets up some good learning opportunities for kids at that age, and I also use this for recreational runners who are maybe newer to running, and not necessarily from the monitoring perspective, but as an educational tool to really tune into how they feel, rather than, it's so easy just to set a pace on your watch and try and stick to that pace without really thinking about how you're feeling. And when you're in a race, you want to be able to run to feel, right? You need to be able to kind of know what that pace should feel like, and know if you're not feeling on that day, or if you're feeling you can go faster. So it's much more important to be able to tune into how you're feeling. And there's been research that's looked at some of the descriptors and numbers on the scale, and being able to tie it to things like lactate threshold. And for instance, about 4 or somewhat hard on the scale is tied to that kind of lactate threshold level. And so I think understanding that and understanding what a 4 feels like, because understanding how the scale works and practicing the scale is really important over time. I think getting that and learning that is really important, more important than just using it as a monitoring tool.
I agree.
So if a clinician or a coach wants to start implementing this today, what is your first step that you recommend?
To start implementing?
Yeah, to start implementing and to use your findings in their practice.
I'll let you take that one with practice, Chris, in terms of the clinical aspect of.
Yeah, from the clinical aspect, I mean, I certainly encourage most of the runners I see. So I guess to back it up, I have runners that come in and see me, and immediately what we're trying to do is detect, okay, what changed in your training? Why did this happen now? And so people immediately look to things like mileage, because again, they track it. They look to things like footwear because that's easy to identify, and it takes some time to delve in a little bit and figure out what change in their actual training load. And I remember Max, I think he tweeted out a graph a few years ago that really highlighted some what changes can occur when you're looking at more than just that mileage. And so I show that sort of thing to the patients and say, look, this is what we're really looking for. And I think a little light bulb goes off in their head sometimes when they see that. They go, oh, well, you know what? Yeah, I took it down week in mileage, but I was really working on my speed, and I did a few workouts on the track or whatever. And so, identify that change. So I think that's important just from an educational perspective. And then maybe going forwards, they have a bit of a better idea of, what they're really looking for in terms of changes. And then, educating when I've got people, rehabbed and leaving the clinic, being able to say, hey, look, this is a way for you to monitor going forwards, so that it's a bit easier to identify if you're making rapid changes that aren't necessarily reflected just from your volume.
Mm-hmm. So as we wrap up, I want to know what you guys are really excited about in the running research field. So what excites you about the future of running related research?
Max?
Yeah, well, actually, I'll toot Chris's horn a bit here. They're doing some really neat work with fabric that can actually measure movements. I'm not sure if you've seen any of that, Kara, but it's really, really interesting, and so that's I think is cool, because if we can have runners wear a garment that can measure their movements every single day when they run. Of course, you might have to do laundry quite often, but maybe in 10 years, 15 years, that's like just the norm. And so imagine if every single runner in the world is wearing clothes that measure their movements. That's like the biomechanist's dream,
Yeah.
And so that's pretty cool. And so that's exciting. And I'm really liking all the diagnostic ultrasound imaging going on right now with quantifying tissue characteristics, tendon, muscle, so on and so forth, and specific things within that. I think that's really interesting for the running literature as well.
Yeah, I guess, clinically, I'd love to have someone come in and be able to just hand me a bunch of data and show what they've been doing for the last, 3 months or 6 months. And for me to kind of look through it and try and pick up some patterns or changes there. I think one thing to note is that often running injuries get all lumped in as the same thing, right? And that it's a change in training load globally that causes any injury. But we know that's not the case. So I think by being able to quantify more specifically loads on certain structures, or in different terrain, different footwear, that sort of thing. The more we can kind of quantify those things, I think it's exciting, because we may actually be able to say that for X injury, these are some of the really specific risk factors. Whereas right now, I don't think we can say that about most injuries.
Thank you. Thank you both so much for joining me again today, Max and Chris. It was a pleasure for having you on to this special episode of JAT Chat on running medicine. Thank you again.